we'll just get right into the questions.
Sure.
Okay, let's start with this. Okay, does blood type matter at all in regards to the coronavirus and catching it?
So this is really a legacy of the internet. There's been a lot of reporting, whether it's false reporting or true reporting, that your blood type somehow is linked to vulnerability. So far, there hasn't been any definitive studies, so the answer to the question is I will hedge on that. I'm sure if there is such a connection, it would more likely be the type of immune system that the patient possesses, given their blood type.
Okay.
So genetically determined. But so far, the connection between one type being more vulnerable or less vulnerable is unproven.
Okay.
It doesn't have a specific answer.
Does the virus leave lasting lung damage?
Yes, it can.
Okay.
And that too is also a matter under study. Those who have had the severe form, who've been either in intensive care units or hospitalized or been on a ventilator, are being studied for permanent effects. Again, the answers are being developed rather than already given, but there's suggestion that it does cause some permanent issues.
Okay, let's see. How important is it to remain in place? This is an old question, so I feel like this has been kind of answered. But I guess remaining in place, staying in quarantine, all of those things. How important is it that we still adhere to those rules?
In other words, the isolate and confine.
Correct.
That has more to do with spread of disease rather than specific susceptibility to disease.
Okay.
And it's a good idea to maintain these guidelines.
Okay.
I think that they will loosen up pretty quickly now that it's spring.
Okay.
But the issue of not being in a contagious situation or scenario is to the benefit of everybody, and it will slow down the spread.
So we're seeing that it's working and that we have to continue doing that.
Yeah.
Okay. This is an interesting question. At home, how often do you have to wash your hands?
That's a matter of choice, but the more you do it, the less likely you are to develop an issue.
Sure.
Either randomly or unintentionally. We live in a germ world.
Right.
We don't live in a clean world. And the concept of doing frequent washing and wearing a mask and doing some of the other eating properly and sleeping and so on, is just to put the individual in a position where they're more likely to avoid or resist the impact of a viral exposure.
Okay.
How much virus you're exposed to is not a matter of how many times a day you wash your hands, but developing the habit and staying ahead of the curve, as it were, is a good idea.
Right, and the whole idea, right? Because once we're in our homes, if we haven't left and we're not really touching anything that's been contaminated to the outside world, I mean, how much do we need to worry about it?
Not really.
Okay.
No more than you'd worry about random contacts at all.
Yeah.
There is a suggestion that the amount of virus or viral burden that the individual is subject to will also determine the outcome. It's proportionate.
Okay.
It's always proportional.
Good answer. Okay. Okay, let's talk about masks. I want to talk about masks.
Masks.
The first thing I want to ask about, I wanted to get those other two questions out of the way because those people wrote about that before we even had done the second video. So here is this. Okay, do scarf masks work? And can we talk about the process of masks and how people can really help themselves if they don't have access to any sort of mask, so they can't buy any, how they can make them? Yeah.
All right. First, you have to put it into the context. Where is the mask being used and what is the purpose of the mask?
Right.
So we would see a different setting for somebody who's dealing with patients who are acutely ill from COVID-19. And in the care setting, you have to have a fitted PPE, personal protective equipment. Now, that process becomes much less, if you will, rigorous once you're outside of the setting where you're encountering active COVID-19.
Okay.
However, if you look at the results of a country like South Korea or Taiwan, and even parts of China, where masks are sort of de rigueur, where people have been doing it for a while, it's cut down on the amount of transmission. Now that doesn't mean that a bandana, a mask, a scarf, or any of the rest of them hold any particular advantage over the other. If you're not using it as a PPE, as you would in a hospital setting, in an intensive care unit or an emergency room, if you're doing it just to cut down on risk in general, and everybody does it, then you'll cut down on transmissibility. How much a different format of mask will work, how well they will work rather, that's really a different kind of an answer.
Yeah.
But depending on how well made the mask is, how fitted it is, and how it's taken care of. If you're wearing a reusable cloth mask,
like a bandana,
like a bandana
or scarf,
right? Or we saw that video of the handkerchief being folded and then with an electrostatic cloth in between. They work well, but they have to be cleaned, and they have to be the surfaces have to be renewed. Once a mask becomes moist, and remember, you're breathing into it, and exhaled air, your breath is loaded with moisture. As it soaks the mask and soaks the cloth and the material, and of course depends what material did you make it out of, that material itself will defeat the purpose of the barrier that the mask supposedly represents. As soon as that happens, you're actually vehicling anything that becomes embedded in that mask into your airway. So you have to know how often to change it, how quickly the mask becomes saturated, whether or not you're in a setting where you're at high exposure risk. If you're walking around your yard or in a garden,
going to the grocery store.
Going to the grocery store, you're going to encounter other people. Therefore, you have a different level of risk. But if you're just wearing it around to cut down on casual exposures, it'll work fine. If you're in an area where there's going to be numerous other people, probably not so good.
So then for people who do need masks and are going out to the grocery store like so many of us and don't have access to masks, what would you recommend they do?
Well, at this point in time, the way to fabricate a mask is all over the internet.
We'll include some links to that too. We found a couple that were really good.
We're good.
Yeah.
The use of a mask by everybody, if everybody in the grocery store, for example, was wearing a mask, then it would lower the risk for the entire population in the grocery store. If you had half of them not and half of them doing it, you're probably not getting much protection. So, and the reason there's such ambivalence, in part, on the use of masks, and that goes back to what the CDC and the World Health Organization actually said about masks, is they, quite frankly, wanted to divert medical grade masks to the medical industry, to hospitals, to caregivers. But everybody would profit by one form or another of masking. And whether it's with a cloth mask that's clean and fresh, or whether it's paper that's well fitted.
What's the difference? When you say cloth mask, are you saying a homemade mask?
Well, I don't think you can make a homemade mask out of paper. You need filtration qualified paper.
Cloth would be like an N95 mask?
But cloth with an electrostatic filter in it will work really well. And it's a renewable mask. And you can fit it fairly tightly without being completely uncomfortable. The mask itself still has to allow you to breathe. And many people you'll see wearing below their noses because it's uncomfortable. That
wrong.
defeats the
I
purpose.
know, I saw somebody doing that.
Yeah.
So, well, and just to be clear, again, there is a video that we found that we'll share where this woman is showing you how to make a mask out of, like, she had a bandana, she had a washcloth, and she actually took HVAC filter paper.
It's actually cloth. It's a filter.
Okay.
And you get it at Home Depot or Lowe's or one of those stores.
But you can only use it once.
An electrostatic cloth,
right?
The kind of thing that goes into an HVAC system,
right?
Can be cut into the proper size, and then when you clean the mask, you throw out the cloth.
Yeah, and I actually did see the Surgeon General put a video on the CDC. It's like a 30-second clip where he's making the exact same mask, but he didn't put one of those.
Right. I noticed he didn't put a filtration.
So I'm guessing if you really need a mask and you don't have access to the filtration system, you can still do that.
Yep.
But can you talk a little bit about the proper way to put it on and take it off and make sure, all that stuff and not to touch?
Yeah. They've made this sound ultimately very complex. That you've been wearing a mask all day is part of the story that is given on the CDC. But if you take it off the wrong way, you spread all the germs. It's not that complicated. It really isn't.
Okay.
I mean, we're not talking about doing something that, requires a skill set and a degree, but you'll be putting it over your ears. So what you really do is you remove it by both ears coming forward.
Okay.
So that you don't smear it all over your face. But I think if people are wearing a mask, they're not going to crush it and use it like toilet paper on your face. It's just...
They're not going to use it to blow their nose. Let's hope not. Oh.
And the other thing that they made a big point out of was that homemade masks don't fit tightly.
Right.
That certainly is true in one sense, but I think most people would recognize that you have to have a proper seal around the portal of entry, nose and mouth. And doing so with the triangle that fits over your nose and under your chin.
Mm-hmm.
That's enough.
Okay.
They show that, but for whatever reason, they seem to emphasize that you don't know enough to not put half of your face on it, and just, not do the thing around it.
Well, we've seen some people do that.
Well, they defeat the purpose of
a mask.
Of the barrier, right? And think of the mask as a barrier, not just something that you can use to hide your identity.
Right. But so the other thing is, I know that you can buy, cotton masks that don't seem to really have any protection other than just you tie them around your nose and your mouth. Is that good enough? Or are those kind of like you're taking a chance?
The old cotton masks were what the surgeons used for many years. That was part of the sterile equipment that you'd gown up before going in, and they had a cotton hat on top of that.
Right.
The improvement with having a slight clip or something over the nose to keep it tight to the face, and all the rest of it came later. The real question here is, again, the setting. If you're going to be in a place where there's high risk of exposure, you'll want it to be tight. Meaning that you're in a care setting.
Or let's say a grocery store, because I think most people that are going to watch us are people that are going out to the store. Because I've already had a couple people write in and say, hey, like I'm going to buy my groceries and I want to put on a mask, but I don't have one.
Yeah.
All I have is this scarf or this bandana. Does this work?
Not as good as a mask.
Okay.
And of course that means you haven't folded it and fabricated a mask like barrier.
If you have like a bandana and you're tying it and it's still open on the bottom, that's a problem. But if essentially you can make it into this folded mask with the ties, they actually the one girl uses hair ties, elastic hair ties. That's okay, right?
That should be fine.
Okay.
And at the same time, a suggestion: you're going to the store, get some nitrile gloves.
Okay. Blue
gloves. Having on gloves and a mask, you're less likely to play tug of war with the mask.
Right.
You don't want to touch it a lot.
Right.
Once it's in place, you leave it, you walk away from it. And having the gloves on, you're not likely to touch your face and your eyes and all the rest of the elements that are a matter of concern for exposure.
Yeah, and if you're going into a store, just leave your phone in the car. Like, I don't even take my phone anywhere I go anymore. I put it in my glove box when I get in the car. If I have to go to the store, mask and gloves, and I don't even touch it until I get home and my hands are clean.
Right.
Because that's really where you can transfer all of your germs, and you're bringing that home, and people are not aware of these things.
Yeah, and even if you wipe down the cart or the basket that you're using, you're still touching something that's had lots of other touches.
Yeah.
And just opening up a door or touching a countertop or picking something off a shelf, shopping for a dairy product or a frozen, you're going to have contact with the outside world. You want to limit the amount of time you spend touching yourself, either in your face or adjusting the mask. You want to leave it alone.
Yeah, once you have it on, don't touch it.
Yep.
But so long story short, if you just have a regular scarf or bandana, it's really not advisable.
Not so good, no.
Because you had also talked about how the danger with that too is if you don't realize, it can then become a vector for giving you the virus. Because if you put it down or you touch it in the wrong way, and is that how easy is it for something like that to happen?
Exposure.
Yeah.
You know, you're trying to limit exposure. Think in terms of this, that everything you're touching can be a vehicle.
Okay.
And if that's the case, that's what a vector is. You're defeating the purpose of the barriers, of the gloves, of the mask, and limiting the amount of time you spend touching a surface that and then exposing yourself to the content.
Right. Okay, I think that's good. I mean, anything else you want to add about masks?
Not really, but I think we've been, of all the examples of misinformation that were out there, the masks would probably rise pretty close to the top.
Well,
we were told not to, and then we were told to do it, and then we were given a set of instructions that make it sound like if you do it wrong, you're going to be punished or something terrible is going to happen. It's a mask. You know, it's a barrier for your nose and your mouth.
Yeah, and I think, well, you said it in the first video. You were the first one to say that. You said, hey, if everyone was wearing masks together, they would be 90% effective.
It would be the equivalent of isolating ourselves.
Right.
Even though you're in public. They claim that it doesn't stop you from getting the infection, but it stops you from spreading the infection. So I don't exactly know how that's supposed to work. You know, I mean, it's you know, anyway, it's up is down and down is up with half of the.
Well, again, we know understanding that the purpose of that was so that they could, you know, diverge all of the masks and gloves to medical professionals who really, really, really need them right now. But the reality is we should all be wearing them if we can.
There's nothing wrong with being safe.
Yeah. Well, I think the fact that so many people are coming out and making these videos is really helpful. And it's good that we sat down and watched those because you could debunk which ones were good and which ones were bad. Okay. Speaking of, how many times can you reuse plastic gloves and a mask when you go outside?
Again, I guess it depends on where you're exposing yourself, but using a mask is generally a single only use. And once you've taken it off, it kind of is done. What
about an N95?
N95s as well, but they work in a slightly different way. Everybody knows by now that N95 stands for 95%.
I don't think everybody knows that. I think I didn't know that until you said that to me. So explain that.
it cuts the amount of particulate matter by the size of microns, which is a very small little thing. Yeah. But N95 means 95% of particulate matter is filtered out. The standard paper mask, when it's brand new, can be 80 to 90% depending on the material. But once it's gotten used or is moist from use, from breathing, it goes down to less than half of that.
We're talking the paper masks or the 95 and 95?
No, the 95 tends to retain it for much longer.
Okay.
You can get away with wearing that for longer periods of time and with less angst over is this working or not. But they're not comfortable. N95s tend to, be really form-fitted and tight. They have a more of a skeleton.
Right.
They have more of a 3D shape. But I'll get to the glove part of it in a second.
Yeah.
But the reality is, once you've used the mask, you should really not reuse it. Now, if you've only used it to walk through your garden, and you get it back in and it's still dry and good, you can use it again that day, and probably even the next day. But that's not recommended. And I'm just telling you, you don't have to automatically throw them out. And with the masks that do have the elastic earpiece, salvage the earpiece, because you can use them when you fabricate other masks, if you make them out of cloth or you reuse.
Right.
All right.
Right.
So you'll have that kind of ear elastic, because quite frankly, putting a rubber band over your ear, it gets a little old quickly.
Yeah.
Now, as far as the gloves are concerned, depends on the material you're using for gloves. The nitrile gloves, the blue gloves that you see,
those are like hospital gloves.
Yeah, they're generally throwaway
It's the ones they give you at Sloan.
Yeah.
Okay.
And what I've taken to doing is I'll wear the glove and then I'll wear a cotton glove over it.
Oh, interesting. Okay.
So that I can preserve the glove for more than one use. Because what will happen is you will turn it inside out when you take it off, then let it sit for a day or two. You can actually spray it with Lysol and let that dry, and you'll have a glove that you can use more than once.
That's actually what I did with my gloves.
Yeah.
I have some of those blue gloves, and I just will use it. I'll use hand sanitizer on them.
That's good.
Take them off, let them dry, and then reuse them again the next time I need to go somewhere.
That's perfectly acceptable for a couple of uses.
Okay.
Again, it's not a specific recommendation.
Right.
And if you were in a hospital, you would discard them every time you went into a new patient room or into a new setting where you were seeing people. It would be changed each time you did any procedure. But we're not talking about people that are going grocery shopping, changing the gloves every time they go into the cold cut section and then they go over to the ice cream.
Right.
It's,
that's not necessary.
Not necessary.
And nobody has access to that kind of material like that.
Yeah.
Barely,
but remember, you're doing it because the gloves will remind you not to touch your face.
Right.
It really is a good reminder.
Okay, so speaking of gloves, what about like yellow rubber gloves that you would buy in packs for washing your dishes?
Yeah. Those are obviously not throwaway gloves.
Right.
And you can use them for a number of things. I wouldn't go into a store wearing vinyl gloves to do dishes. But those kinds of gloves will act as protection to you, and you're not likely to touch your face. And you can use an alcohol swab on them. Any one of the sterilizing agents like Lysol and so on, and you can let them dry, and they're perfectly good to use again. Again, the material counts, but the use pattern is also really important. That if you're using it just for a barrier like the mask, then chances are that's not really a good use for a vinyl glove. Yeah, of course. I was just saying, in worst case scenario, because I know they have some of those like dishwashing gloves that are actually thinner and tighter. So it probably makes more sense to walk around with the giant yellow ones. And surgical gloves, sterile surgical gloves that come in a folded format and in an envelope will actually go up above your wrist and over the scrub that you're wearing when you're going into an operating room. And of course, they're put on after you've scrubbed, after you've washed. Single use. When you strip them off inside each other, and they go into the garbage.
Trash.
Yeah.
Good thing to know too, because they don't tell you how to properly take them off, and that's a good thing to note. So.
Yeah.